what the clinical signs you see in this hand?
Pale.
She is pale.
Dry.
She is pale.
Coldness.
It means what?
Anemia.
Most probably anemia. Sometimes pale hand is normal, but most probably anemic. Her hemoglobin was 7, والPCV 22, and her blood film is what is microcytic hypochromic anemia, iron deficiency anemia. And what else causing microcytic hypochromic anemia? Thalassemia.
Sideroblastic anemia.
Sideroblastic anemia. But iron deficiency anemia is the most common,
For women.
especially in women. What are the physical signs you look on the face in anemia?
Pale face. Exophthalmos of the eye.
Exophthalmos is a different entity, and pale mucosa.
معرفة.
Okay. And what else? There is angular stomatitis. This is one. Angular stomatitis there. And a smooth tongue. What physical signs in the hand? You see, you see, we look for what colonychia. And here, just like this, you can put a spoon-shaped nail.
ترى عندنا ليكونيكيا مو وايتنش.
And we look for clubbing, because if we see colonychia, it means this is iron deficiency anemia, characteristic sign of iron deficiency anemia. But if we see clubbing in anemic patient, we look for a malignancy, connective tissue diseases, lymphoma, etc., as a cause of clubbing in anemic patient. Okay, this increase is not red. Therefore, the hemoglobin is most probably how many?
Below 7.
Yeah, it is around 7 grams hemoglobin. Okay. What question you should ask this lady?
About anemia?
About anemia, the cause of anemia.
Menses. It's heavy or not?
Yes. She had a heavy menses, more than 10 days, and 7 days of the first 7 days are heavy with the clot, and she changed more than five bloods in her menses. Therefore, most probably this is the cause of iron deficiency anemia. Even though she have lost appetite, yeah, and she had exophthalmos. What's correlation between this and this?
Autoimmune?
Yes, autoimmune. She had thyroiditis actually, Hashimoto thyroiditis, and she had exophthalmos at that time, and then nowadays she is hypothyroid, yeah, because Hashimoto in the early stage we get a cellular infiltration and destruction of the thyroid cells and all the hormone in the blood, T4 and T3 in the blood, and therefore you get signs of thyrotoxicosis. Later on, it will go to what? To hypothyroidism. Is there any clinical test that we can see and that we can do, and we can say that this Hashimoto patient in the early stage of thyrotoxicosis is going to have hypothyroidism?
Peroxidase antibody.
Anti-peroxidase antibody, if that is positive and high, it means this lady is going to have what? Hashimoto. She had goiter actually, exophthalmos, and this is exophthalmos. She got gastric pain. Why?
Gastric pain?
She is anemic. Yeah. She had Hashimoto, and she had gastric pain. Might be she might have something in the stomach causing bleeding also too, or might be this is gastritis, autoimmune gastritis, because Hashimoto is what? Autoimmune disease, and the anemia it most probably should be what? Macrocytic B12 deficiency, because what do you call it, this anemia? pernicious anemia. Okay? In pernicious anemia, if she got gastritis, it means the body, not the pre-pyloric, the body and the fundus involved in autoimmune gastritis. While if the gastritis in the pre-pyloric area, this is what due to what? To H. pylori. H. pylori can cause this gastritis. She had difficulty of swallowing. What do you think?
Because pressure.
Might be due to her goiter and might be due to Lamar-Vincent syndrome اللي هي web يصير وين
esophageal or dysphagia, iron deficiency.
yes dysphagia and iron deficiency anemia precricoid area and it is pre-malignant. Okay, therefore this lady, she got iron deficiency anemia to heavy menses and heavy bleeding, and she got hypothyroidism. She is on thyroxine, but still the TSH is more than 6.7. It means that she is not well controlled. Okay, we should bring the TSH from the high number till 2.5. I mean, this is the control, the target control of hypothyroidism. You have to bring the TSH till 2.5. Any question?
نعم دكتور. دكتور الإكزوثالموس it's reversible.
Exophthalmos usually not reversible.
What the mechanism of the exophthalmos?
It is hyperplasia of tissue behind the eye, pushing the eye forward. Okay,
It's been irreversible.
it may usually irreversible. In exophthalmos usually occur with what? With Graves' disease. Thyrotoxicosis in general, 85% is Graves' disease caused, usually in female, 8 times more than male, and it is an autoimmune. And this is Graves' disease. You get a goiter, you get a smooth surface goiter, and then it is soft, pulsating, and there might be thrill. And this is the Graves' disease with eye signs clear. The second cause of thyrotoxicosis is multinodular goiter, usually occur at the age of 60 and more. And this is goiter there is, and it is nodular, just like my finger, nodule, multinodular, but toxic. This is toxic nodule, that's in around 10%. If there is any hot nodule, you see it on the left, on the right, a nodule, a big nodule, and causing secretion of more T3 and T4 and suppressing the TSH. Okay, the other causes of thyrotoxicosis in the early stage of Hashimoto. You get it thyrotoxic state, what do you call it? And the other is rare, اللي هي factatia with Gervin, tumor of the thyroid secreting or extra thyroid tissue secreting what? Hormones. Any question?
دي كيف الفيرال انفكشن
اوكي، هنكمل سويت المفرد.